All right, welcome again to the Active Health Podcast, where we're going to talk all things health, fitness, and performance, and we believe in taking an active role in your health. Today, we have with us a very special guest, Dr. Phil Harrington, who you are going to enjoy hearing so much about laser therapy. He is an expert in the form of laser therapy, one of the most important tools that we use here at Active Health Clinics, and I look forward to him sharing some information with you. Welcome to the podcast, Dr. Phil.
Thank you so much, Dr. Josh. Appreciate the invitation. I'm real happy to be here. Thanks.
Absolutely. And I do want to give you a little, I will read your bio here from the Summus Laser website real quick, just so we can get some credibility here, Dr. Phil. So Dr. Phil, he is a chiropractor. He graduated from Iowa State University in 1987, went on to earn his Doctor of Chiropractic degree from Palmer College in 1996, and was in private practice here in Iowa for about 10 years. And at the time, he was using various therapeutic lasers. Dr. Phil does have a passion for publicizing the power of using the therapeutic laser in a variety of clinical settings, and has created demand for his now thriving speaking career, and has led him to become a sought-after national and international lecturer. You're sharing with me, you're overseas, on the subject of photobiomodulation, which is, we'll talk about that as the laser therapy, physiology, science, safety, and clinical applications. He's been involved in the laser industry for more than 15 years, and currently he serves and holds the positions of medical director, clinical manager, and laser safety officer of the Summus Medical Laser. And he currently has recently moved back to Iowa. Welcome back to Iowa.
Yeah, thanks so much.
It's great.
Yeah.
So I'm always curious. It's so fun, especially as chiropractors, to hear the story, how we got into chiropractic. So how did you get into chiropractic, and where in your chiropractic journey did you end up using the lasers?
Yeah, so it kind of started out, I just kind of followed the footprints of my older brother, Bill.
Mm-hmm.
So when I graduated Iowa State, I did teach high school math and physics in Harlan in southwestern Iowa for 3 years. And my brother, Bill, had been a math teacher in Belle Plaine. Then one day he played golf with, his name is Dr. Rolfson, a chiropractor from Forest City, Iowa. And during that round of golf, Dr. Rolfson talked to Bill about becoming a chiropractor. So Bill went to Palmer in late 70s, early 80s. And then I got to visit his practice. He and his wife, Gloria, had a thriving practice in Marengo, Iowa. So I would visit them and see the fun they were having in practice, and being able to help people and all that sorts of things. So I would have loved to stay a teacher forever. But then I shifted gears and went to Palmer and graduated in 96. And, for me, it was a natural fit to go from learning about physics and then using lasers in healthcare. So that was what drew me into using lasers in my practice. And then as time went on, I was getting frustrated with some of the things that were being said about laser therapy in the chiropractic profession that were really not based in the science and the physics. So that kind of drew me to working with the company, Summus Medical Laser, and lucky enough to be here. It'll be 18 years this year.
That's amazing. It's always fun, everyone's story and how they get into chiropractic. And more I think it's usually most commonly two areas, is they have an amazing experience themselves with care, or they know someone that's a chiropractor and sees the benefit they're having with all their patients. So that's fun to see how that worked out. And it's always neat to see the navigation of people's lives and the skills they have and the passions they have and how they lead them in different ways. For you to go from, having the science background and the teaching, and obviously you can apply the science. And actually, as doctors, we teach our patients quite a bit, but now you're really using that science background so much more with Summus, and obviously teaching. I mean, that's where we met you, is at one of the seminars we attended that Summus puts on. And it's just neat how God puts those things in our way and can navigate us right to where we need to be. That's so neat.
Absolutely. We just had one of those classes last weekend, and had a wonderful attendees, and we got tremendous feedback. And it's not just chiropractors at the class. So this last time we had physical therapists, we had a doctor of osteopathy, a DO, a nurse practitioner. And it's just, I just enjoy telling people about class 4 laser therapy. And so a few weeks ago, I was in Romania and Slovenia talking with physiotherapists there about laser therapy. And then on Monday, I leave for Malaysia. And my friends in Malaysia have a number of meetings set up, and most importantly at some hospitals throughout the country, but then also with the physical therapists that work with the Malaysian Olympic team, which will
amazing.
be a lot of fun. Yeah.
Hey, do you feel, this kind of maybe slightly off topic, do you feel you're well received in other countries? Is it easier or even more well received, or how's that going?
Well, one thing I like when I go to these places, we're working with the people that distribute the Summus lasers in those countries. So they take care of me. They pick me up from the airport and escort me around and all sorts of things. But then also the meetings that we have, and we'll go to individual clinics. I will do some classes. We'll go to hospitals. The reception is tremendous. They have, in all of those countries and many other countries around the world, they have fully embraced Class 4 laser therapy as a part of their healthcare.
Yeah, that's amazing. And as we continue to do it more and more in the U.S., so it's great. Well, let's just dive right in. I tell you what, a Class 4 laser. Can you go ahead and just explain it to people what it is? What is laser therapy? What are we actually doing?
So first off, with the laser classification scheme, there's 1, 2, 3, 4, 4 being the highest. And the true definition is hazard to the eye, but you can also break it down to the power level or the brightness of the light. So once we're above 1/2 of a watt, then it becomes a Class 4 laser. But it's important to point out that with the therapeutic lasers that we're using, the laser beam itself is allowed to diffuse and spread out, and therefore the treatments that we give are very, very safe. So then we're also using red and infrared light. In our Summus devices, we're using 4 wavelengths, 1 red and 3 infrared, which is non-ionizing light. And then when that light is shined on the body, there are different components in our body that are able to absorb those photons of light, and some of it gets converted into heat energy, which helps to improve circulation. But most importantly, those photons of light get absorbed by the oxygenated hemoglobin in the bloodstream, which releases oxygen to the tissues that we're treating. And then also it stimulates an enzyme inside of the mitochondria in the cells that helps with energy production in the cells. Yeah. So the net result is better blood flow, better tissue oxygenation, and more energy being produced from the cells in the body.
Which makes the cell itself healthier, and it makes the organism of the entire body healthier as well. Such neat, and that's the term photobiomodulation, right? That's where they're using the light to actually modulate the tissues, right?
Right. Yeah. So I mean, you could get as complicated as you want in the description, or you could just simply say we are improving tissue health. So with laser treatments, we're really not targeting specific conditions in the body. We're helping the body to heal itself, which, I mean, that fits right in with chiropractic philosophy.
Yeah. I was just going to say the same thing. Yeah. That's kind of what one thing we love about it and using it in our clinic is, as a chiropractor, just like you said, is we're all about helping the body help itself, helping the body use innate intelligence to heal, and just trying to clear things out of the way so that the body can heal. And the laser does just that, using something so natural as light to help the body regulate and do things appropriately. Just like, now, sometimes not any better than it should, but just exactly how it should do it. Right.
Right. Yes.
It's so fun. So you kind of mentioned there how safe it is. Is there any contraindications to using the laser?
Well, the main contraindication is going to be don't shine it directly in the eye. But however, we can safely give treatments to the sinuses, the temple, the forehead. So some possible indications there would be sinus inflammation, sinus infections, but then also for headaches. And then there's also some interesting research coming out on improvement of cognitive function and helping with other brain-related disorders.
That's interesting.
And then elsewhere in the body, we have to be very careful handling any patient that may have cancer or pregnancy. Right. But let me just say that 15 years ago, our concern about those things was extremely high, but now there's getting to be more and more evidence. For example, with cancer, with pregnancy, there was a study published recently that did use Class 4 laser therapy, and all of the patients in the study were pregnant females with carpal tunnel syndrome. Okay. So when you have a published study on a pregnant female, and they're using laser with no adverse outcomes. And then also with cancer, our concerns about using the laser that either has active cancer or is in remission from cancer, our concerns there have dropped significantly. So such a safe modality to use.
It is. And I think that happens with so many of these things is the pregnant women are always kind of the last to study. But, especially when you're using it and treating it from, away from the fetus, it can be, I think, if it was my wife, I'd probably use it just about anywhere. But we always
I
have to
have
be
two
careful.
daughters. If and when I'm going to be a granddaddy,
Yeah.
I will not hesitate to laser them.
Absolutely. And so we currently are treating, the most common things we treat in our facility are whether it's acute injuries like sprains, strains, acute tears, all the way to chronic conditions like osteoarthritis, and even some nerve-related tissues like you mentioned, the carpal tunnels. And we have a great neuropathy protocol that we're taking patients through. Are those the most common conditions that other offices and people are using the laser for? Or
Yeah, that's a good list there. I guess in part in chiropractic offices, it depends on the patient population.
Right.
If it's a general chiropractic practice, you're going to be seeing anything and everything.
Yep.
But then also we do have some people that specialize in conditions. For example, we have a dentist from California. Her name is Dr. Chelsea Pinto. She has developed protocols for newborns, for mothers right after childbirth, and working on things such as tongue ties and difficulty in the baby latching onto the breast, as well as helping the mothers with things such as cracked nipples, mastitis, or blocked mammary ducts.
Yeah.
So it's sometimes
That's so funny that you just brought up the tongue tie. I literally just watched a video the other day of someone using laser therapy for tongue tie, and that was the first time I'd ever seen that. That's really neat. But yeah, it's a matter of the practice that you're in. But I guess the point there is it's so interesting in how diverse the laser is, and kind of how I explain that to a lot of patients is when you're trying to just help the organism be as healthy as possible, like we do with chiropractic and like we are with laser therapy, is it seems like we're saying that we're treating all these different things. In actuality, we are treating those symptoms and those things, but ultimately we're treating the person and making their tissues and themselves healthier. And then the expression of health is just the lack of symptoms.
Absolutely. Right.
And so that's why I feel like it just mirrors so well with the chiropractic and what we're doing. So that brings me to some kind of questions that patients will ask a lot, as you've probably recognized is even at home lasers or red light therapy is becoming more and more common, and there's more and more avenues for patients to purchase these devices for at home use. You briefly at the beginning went into the classes of lasers, but what is the main difference between something like our Horizon Class 4 laser, which is the top of the line laser that we have here, versus something that someone could purchase and have at home?
Yeah, so I'm happy that photobiomodulation and light as a therapy is getting to be more and more popular. However, when you sell a device for home use, by definition, it has to be extremely safe.
Yep.
And with any light-based device, that means it's either going to be an extremely low-powered laser, which is just simply not going to be as effective, or it's going to be light-emitting diodes, pads of light-emitting diodes. Now, not to say that they don't work.
Sure.
However, the Class 4 therapeutic laser is a prescription medical device, and just simply the outcomes that you're going to get with Class 4 laser are going to be superior. And what I say is, if you're going to do something, do it right. Do it properly. So whether it is treatment with the Class 4 laser, and then I know also in your clinic, Dr. Josh, you have the Vita bed, which we call whole body photobiomodulation. So with that, the patient lies in there, they're exposed to blue, red, and infrared wavelengths of light, which will give systemic benefits to the patient.
Yeah, and patients love that. The more and more patients that we have that get into the light bed, they just feel like you can almost just feel a charge. And for a patient description, it looks like a tanning bed, but there's no UV radiation. So it literally looks just like a tanning bed. You get in it. And it has, the great part is it has these nice little protocols just make it easy for the patient to decide, hey, what's kind of my goal for today, whether it's, rejuvenation for skin, or there's obviously pain relief settings and different settings, recovery, athletic recovery, come with a couple of the settings, and patients just get a great results with it. And to just comment on like the intensity or the safety component of our Class 4 laser you mentioned that the eye protection, because all of our lasers come with eye protection. So everyone in the room at the time of the laser is wearing, Pacific goggles to protect their eyes from it. So it's definitely something you want to, it just speaks to the power of the laser. It's real, very efficient. So I'm just trying to get to some other questions that patients may ask us quite a bit. A lot of times patients really question whether can light make that big a difference.
Yeah.
I mean, I think they're just kind of like blown away that it can. And how can you speak to that?
Yeah, that's a common question that we've been asked over the years. And, early on when there were many people who were skeptical about laser therapy, we would just point out, first off, plants absorb sunlight and through the process of photosynthesis, that's how plants and trees grow. But then also light will have an effect on the human body. One good example is the use of light on babies that are born with jaundice, shining the light on the liver. But then the simple fact that you can see me right now is proof that light does have a biological effect on tissue. But as a laser therapy advocate, what I really like is that over the last 15 years, our understanding of the mechanisms, how does it exactly work? Once we can explain how it works, then the acceptance of it as a modality is growing, but then also the number of published studies. So what's exciting for me is over the years, we've seen more and more acceptance from all healthcare professions, not just chiropractors, but physical therapists, athletic trainers, and even medical doctors, osteopaths, pain management doctors, etc. And maybe one of my favorite examples recently is that at Duke University, they have an innovative pain clinic, and they are using a Summus Horizon laser as part of their pain management tools at Duke University.
That's so great. And it's good to see that. And I think we do need more and more research to prove the why, because there's always going to be the skepticism of the placebo effect. And I'd be honest with you, if someone gets better, I don't care if it's a placebo effect or not. If the results is what drives me, but it'll be nice to have that research to back it up, so that it can just validate the effectiveness, and it's not just the patient's head. But that's really neat, because I think the other part that we continue to improve upon, which I kind of like, but we're still working on the exact protocols. How many times a week? How long are the treatments? What waveforms are we using? And the more and more efficient we can get with that, even the outcomes will even get even better.
Absolutely.
It's fun to see.
100%.
Do you have, we'll get to a kind of maybe a lighter note. So you've probably, lately you've been educating patients and doctors, but have you, way back when you were practicing, do you have a favorite particular case or anyone that you helped that was with a laser that just sticks out in your mind?
For me, early on, it's not going to be one particular case, but what I found particularly rewarding is I would have a number of patients that had joint replacement surgery, whether it was a knee or a hip. And so they would have the surgery. The surgeon would declare it a success. However, the patient would still have significant swelling, redness, and pain in the area. And one cool thing about laser, another cool thing is we can use it over metal in the body.
Yes. Yeah,
so we can safely use it over those joint replacements. And I had a stream of patients that had knee replacement surgeries, and then they would come to me, and I would be able to help them so that they could be up and active after the surgery.
Yeah, because it's just traumatic. It just does such a great job at healing.
Yes.
That was one of, we had a couple, probably in the first 2 months we had our laser. My nephew, who's my brother, practices with me, and so it was his son, fell off a tree and broke his arm, and he had a state tournament in a couple of weeks for baseball, and we did class 4 laser every single day for 2 weeks, and he was healed and ready to play. So it's just amazing the speed of recovery for it. But
you have the before and after X-rays from that?
I should look. I don't remember if he did. I think he actually did. So we have to. I'll have to pull it up.
That'd be cool. I'd love to see.
That'd be neat to see. Yeah. But every day, it's similar to that experience. Is we actually are treating a lot of patients, hopefully before the surgery, but because of the healing effects, we could see them after. But so whether it's, again, those are the most common things we're treating, those osteoarthritis patients, trying to avoid surgery. But even after surgery, we can treat them. The neuropathy cases, and the fun case we just had in the last 2 weeks is we had a man come in with post-shingles radiculopathy, horrible pain. He had been struggling with it for several months to almost over a year, to the point where they were considering doing a spinal cord stimulator all the way up to the thoracic spine. He's tried everything. He was miserable on gabapentin, on a bunch of medications. He literally, after the first laser treatment, went home and cut it on his own. I didn't tell him this. On his own, he cut his gabapentin in half because he didn't like it how it made him feel anyway, but he was feeling good enough that he did so. And now here we are 2 weeks in, and he's reporting 40% improvement in his pain. And we're about halfway through his treatment. We're kind of taking him through a very similar protocol than we will with our neuropathy patients as far as frequency. Obviously, it's a smaller area, but he's very happy with how things are going. It's so neat to be able to give people hope in conditions that maybe they didn't think were ever going to be helped. So
Absolutely.
It's fun. Yeah. So we're able to help patients because of the safety of it and because of the ease. I mean, honestly, the laser therapy is so easy to provide to a patient, but it's so fun to do. Well, again, I feel like we've provided our listeners a very good background on Class 4 laser. Do you feel like there's any information we left off, Dr. Phil?
Well, one, just emphasize that we can safely use the laser on people of all ages. So if we're talking about an infant with an ear infection or a young athlete with a sports injury, yes, we can laser over open growth plates. Another condition that I want to mention that's becoming more and more popular is the use of the laser to manage inflammation in the lungs, specifically with idiopathic pulmonary fibrosis.
Okay.
So the laser is able to penetrate between the ribs and get into the lung tissue, and actually has an effect of managing that inflammation associated with that condition. And so we have a very strong patient advocate. His name is Lee Fogle, Fogle, and he's written a book called A Matter of Life and Breath. And he has a very active podcast and YouTube channel where he interviews various patients that have gotten help with that condition. So
that's interesting.
That's really exciting also. And just to reemphasize some of the points we've made already, the treatments are extremely safe, yet can be extremely effective at managing pain, inflammation, and tissue damage anywhere in the body.
That's so amazing. And that's why we've implemented as part of our protocols here at Active Health. It's been a fun tool to use. And it's just so neat that they keep coming up with these other things. They're finding it's more and more to help. I mean, we got on board with it because of the neuropathy protocol. And so we brought it in thinking we were only going to use it on neuropathy, and we started using it on pretty much everything. And now we have this another pulmonary condition that can be helped. Again, conditions that typically, like neuropathy and this pulmonary condition, patients suffer with it and they really don't have any other options. And so it's so great, again, to be able to provide patients hope and treat their conditions. It's great.
Yes, absolutely.
All right. Well, Dr. Phil, I really appreciate you taking the time out and spending some time with us and educating us. Thank you so much. If there's anything that we can do for you in the future, please let us know. And thank you for this time.
Absolutely. I really enjoyed it, Dr. Josh, and I want to come over to Fort Dodge and visit your clinic someday. And
that'd be great.
And I want to see you using the laser in your practice.
Absolutely. Will do. Thanks again.